It's fine.
Don't worry. I don't remember anybody's
When
name.
you work with like groups of people, we do music therapy sessions, and a lot of times they're like big groups of people.
Yeah.
So you got to be quick and like remember
Yeah.
everybody's
I
name.
bet. Wow.
It's fun.
All right, so this is everybody. All right, we're gonna pass out some handouts, so you can just go along with this.
Just like an outline.
Yeah.
All right.
What is music therapy? What's easy? It's music.
My other daughter.
Oh, okay. I'll give her
You're not coming in. I got a special chair.
All right.
Who's brother, daughter?
Last time.
All right, so I think most of you know, but for those of you that don't know, my name's Kelly. I go here to Founders, and I go to Sam Houston for music therapy. I'm a student. I have 1 year left. Then I'll be doing my internship, and then.
My name is Rebecca. I go to school with Kelly. This is I have 1 year left studying at SAM, and then I will also go into an internship somewhere.
Yeah, to be determined.
But yeah, it's, oh no, you're good. So I guess we'll just start. One of the biggest questions that people have when they hear music therapy is, what is it? Because it's not very common, you don't hear it very often, it's a fairly new field. So music therapy, I'll just give you the textbook definition, it's the clinical and evidence-based use of music interventions to accomplish individualized goals. And that is within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. And that's a lot to take in. So,
What?
What does it mean?
Does that make any sense?
So basically, music therapy uses music as a tool in order to complete goals and objectives that certain clients will have. We use musical interventions that are specifically designed by the music therapist to help the client reach their goals. And then the second part of that sentence, in order to practice music therapy, you have to complete coursework or degree plan from a certified music therapy program. And so we have that at Sam Houston, and that's what we're doing right now. We have to intern as a music therapist for about 6 months.
Yeah, it's
4 to 6
typically
months.
6 months, depending on how many hours you have before your internship. Because you can get hours while you're in school at practicum, which is where you do the music therapy sessions with a supervisor there.
After you intern, you have to take and pass a board certification exam, which means you have to go in and take a big scary test to show that you are capable and competent in all the areas that you need to be in order to be an effective music therapist. And after you get your certification, you have continuing education programs that you have to go to in order to keep your certification. On to the next one. So, what was this?
Yeah. So what do we actually do? So of course we just play guitar for everybody and help them relax, right? No, it's not all we do. It's not exactly it. So in order to have music therapy sessions, the client or the individual has to have a referral. Like if you're going to a specific doctor, you have to get a referral to go see them. So in order to get music therapy, they have to be referred to us. And once they are referred, then we'll go and we'll do like an assessment session to where we just assess all the different areas of functioning. And then once we do the assessment and determine what the needs are, then we'll create goals and objectives that are measurable and individualized per client. And the domains that we assess, there's cognitive domains, physical, motor domains, communication, emotional, and social. So, for example, like with ADHD, a cognitive goal would be to increase attention span. And that can be one of the goals we work on through the music therapy sessions. For geriatrics, does anybody know what that is actually? The word geriatrics, besides the, no? Okay, what is it? Do you know?
Older people.
Yeah, exactly. So if we work in a nursing home with elderly people, one of the goals might be for memory. So like if they had dementia or just regular memory loss due to old age, we could make music therapy sessions that are targeted towards addressing those goals and improving their memory, short-term or long-term. And then with physical rehabilitation, well, obviously physical rehabilitation is one of the goals. So like range of motion, like being able to move your arms, like how far you can move them out and up, and
My friend Joshua, one time he couldn't move his arms
oh yeah.
or his legs.
I know.
And then, so those are just some examples of different goals that we can work on. Those are just a few though. Next one. So yeah, there's several different goals areas, like I had said, that a music therapist can address, and there's a variety of ways that they can be addressed. And for example, through active music making, which is the clients, which is what we call like the people that we're working with, we call them clients. The clients will be involved in playing the music, and then music listening. That could be a variety of things. For example, lyric analysis, like listening to a song and going over the lyrics and discussing that. We'll talk more about that later. And then songwriting. We can use songwriting as an intervention for emotional expression, or there's a variety of areas, and we'll talk about that one more. And we also work with children, of course. We can work with from infants, premature infants, all the way through the elderly. So we're going to show a video.
I can do it live. No, I have to.
This is music therapy in a children's hospital. Just a little bit about it. Oh, sorry, I don't know if you can see.
Maybe. Come on, YouTube.
There we go.
Twinkle little star, or should we do Old McDonald's? Old McDonald's?
There's something about music that connects the child. There's potential to either maintain their connection with the healthy part of who they are or reconnect them.
Music therapy is using board-certified music therapists to work on non-musical goals for our patients. We see around 100 kids a week.
It's much more than entertainment. We are trying to help kids to walk again using music, or help kids to decrease their pain using music.
We're thinking more in terms of how to support motor skills, how to support overall well-being. So we're not really thinking of it as musicians. We are using music as a tool, but we're thinking of it in a way that's much more similar to other members of the clinical team. Hello, Owen. Hey, buddy.
Owen has had a lot of problems sleeping. Being in here for 60 days kind of wears on you, even little guys. Brian's lullaby assistant in sleeping. I mean, it calmed him down.
She has leukemia, ALL leukemia. She's had some rough days, especially today. She's been miserable all day, and that was the first time we saw her happy and smile. No matter what kind of disabilities the kids might have or challenges they're facing, when you add music to the equation, they suddenly are in this place where they're better, where they feel like themselves.
It's becoming an essential part of how we relate to the children that we work with here, how we treat the children. It's something we wish we could provide for every patient.
But I'm just like,
Twinkle, twinkle, little star, how I wonder what you up above the world so high.
that was just an example of the music
I love
therapy
that
in a
video.
children's hospital.
What you are.
So, Do you actually? I think we should go to the slide about the other those ones first.
Sure.
Or we can. No, we can go.
What?
Yeah, I'll sit there.
Okay, so
Sorry.
we have an example in a musical intervention for you guys if you would like to participate.
So we can just make some music.
We're gonna make some music together. So we have all of these instruments over here we brought in for y'all. So we have, I don't know how many people we have. This is called a glockenspiel, which is a fun word. You don't have to say it.
We
It's
just
a
call
xylophone.
yeah.
It's a big xylophone.
We just call these things orff instruments, so it's easier to say.
Orff.
Yeah.
All right. I know these.
It's a
What
key-
is this one?
It's a
So
key instrument.
We're going to
don't you know?
explain
It's a
how
key
to play it in a
instrument.
minute.
Don't you know?
Yeah.
So let's go ahead.
Let's
Let's
do
go
one
ahead
of
and
y'all
leave that there for right now, and then we'll get into that.
I'll let you play that. I want to play the drum. I want to play the little bongos.
All right. So we have these here. Who would like to play this? You would like to play this? All right. Here we
What
go.
about this? So, alright. There's two of them, so we can have that. Here, I'll bring it.
All right. We have
Maybe
some
you play this one so you can set that down and I'll play that one.
Sorry? Oh,
some
I can bring
rhythm
the other one.
sticks. If anybody would like rhythm sticks, you can click them together and rub them together.
Can I use them as drumsticks?
No, we're gonna use our hands on those.
Yeah.
And we also have egg shakers, which is one of my favorite just because they're really cute.
Alright. Let's see if we can get it.
And do we want to use this one, Kelly?
Sorry.
Are we gonna play one of these or? All right.
One of them. I mean, we could.
Here we go. And so, if somebody over here would like to play this, we'll explain how to do it in a second. There you guys go. And then we have a couple of egg shakers and rhythm sticks, if we want to use that.
Let's see. Would you like to choose one of these? Okay.
Awesome.
Let me grab that. Okay. What did you choose? Oh, you can have two if you want. We have extra. Okay, and then you have, so everybody, and then we just, I think all we
All right. All right. So 1, 2, 3, eyes on me. Excellent. So we have a song up here, and I'm gonna demonstrate using this. On these big xylophones here, you're gonna notice that you have some numbers and colors. So we're gonna be playing a song together, and you say start on 1, and you hit both of the ones on 1 at the same time. Excellent. We're gonna hit that 4 times. So 1, 2, 3, 4. Then we're gonna move on to 2, and we're gonna hit 2 4 times. 1, 2, 3, 4. Good job. And on to 3. 1, 2, 3, 4, and 4. 1, 2, 3, 4. And then we're gonna start over and go back to 1. So let's try that. Sorry, I took that from you.
So whenever we play the pattern, you're just gonna keep repeating this pattern. Let's see.
Good job.
Exactly. Yeah. Exactly like Alex. Good. Exactly. So you'll just do the same pattern over and over. You'll play each number 4 times and just repeat it over and over. And also on the words, if you can see it, if you get lost, the color of the words is the color of the notes that you play on there. So if you get lost, just go to that color.
All right. And on the drums, we're gonna have, who all has a drum? So you have a drum, you have a drum, you have a drum. Awesome. So we're gonna start just with a simple beat, just bum, 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 bum. Excellent.
Yeah, you can just like.
And once you guys are comfortable with that, if you want to improv a little, if you want to add
Okay,
some
you can
rhythm
put that
into it, you can.
Yeah, you just hit it like that.
And then we have rhythm sticks and egg shakers, right? Yep, so this is good. So you can hit it, keep it beat. You can do this. I don't know, these are just fun. I just really like the noise, baby. I'll use these. All right, and then we have egg shakers, and you shake the eggs. There we go.
Alright, so everybody put your hands in the air. There you go, good. Okay, should we just start with the,
Yeah, let's go ahead and start with the xylophone.
so wait till, for the xylophones, wait till everybody's ready. So tell me when you're ready, xylophones.